Hi, in this part, we're going to be discussing the human pathogens Bordetella and Legionella. So the first one is Bordetella pertussis. This is an encapsulated cocobacillus. It causes pertussis or whooping cough. Okay, so there are two names for the same disease. It happens to be a communicable childhood infection. It leads to this acute respiratory signs and symptoms. It could be very life threatening, especially when it happens in babies. Or the reservoir or the source of infection are individuals who are apparently healthy, but they are carriers. And transmission is through aerosol. Okay, so breathing, sneezing, coughing, and so on. Here you can see this neonate that has Bordetella pertussis. And again, the signs and symptoms, first off, you have it usually happens in these two different stages. Okay, the first stage is called the catarrhal stage. A catarrhal stage means that the patient has very cold flu like symptoms. So they have a fever, runny nose, a mild cough, which again doesn't really tell us that it's the whooping cough yet. It shows that the patient is sick. We usually diagnose it as a cold or a flu-like symptoms, and we ask the patient to or the parent to bring them back for a follow-up or to let us know, if anything, if the patient gets worse. Okay, and then if it is pertussis, they go into what is called the paroxysmal stage. So in a paroxysmal stage, they have these attacks of cough, hence the name paroxysmal. And you can see here that there is a loss of appetite. The patient has a very characteristic whooping cough. So the cough, again, this is a little link that you could click on that tells you so you can hear what the cough looks like. It is very characteristic, very diagnostic of pertussis. You'll see here that the patient has difficulty in breathing, and we'll see why in the next slide. Signs that the patient is unable to breathe is that they have these two parts of the abdomen that are indented. That's because the diaphragm is trying very, very hard to contract as hard as possible to get air into the lungs. You could also see that the intercostals are working extra hard, and that's why you can pretty much see all of the ribs for this patient. Pertussis can be deadly, especially in infants, especially in patients who are less than a year old. So, what are the virulence factors that these bacteria have? Well, first off, they have receptors that have the ability to recognize and attach to our ciliated respiratory epithelium. They also secrete toxins that destroy and dislodge our respiratory epithelium, especially the ones that are ciliated. And if you guys remember, there was a mechanism in in healthy individuals where mucus, along with the cilia in our respiratory system, traps different pathogens, traps dusts, and pushes everything away from the respiratory system upwards. We called it an escalator, and then gets rid of all of those. Okay, we swallow it, but we could also cough it out or sneeze it out. Well, when we lose that escalator, we lose all of that cilia, there will be a buildup of mucus that will block the airways, and that's why these patients are having a hard time to breathe. So how can we manage the infection? The best management is actually to prevent it through vaccination. There is a DTaP vaccine. Now, the D stands for diphtheria, T stands for tetanus, and AP stands for acellular pertussis. So, this is a vaccine that has three different things. It has the toxoid for diphtheria, the toxoid for tetanus, and an acellular vaccine for pertussis. It is a 5-dose series vaccine where the first dose is given at the age of 2 months old. So I'll tell you the whole series. So again, the first three doses, ages of 2, 4, and 6 months. The fourth dose is given at the between 15 to 18 months. And then the last dose is given between the ages of 4 and 6 years. Now, this graph shows you the incidence of infection by Bordetella pertussis by year, and it breaks it down by age. So you'll see that purple line that is always higher than the rest of the ages. Okay, so meaning that, and that represents patients who are less or younger than a year old, meaning that they are the ones who are more prone to that infection because, again, they haven't completed their, or maybe they didn't take the vaccine. And if they did, they didn't get the chance to complete the whole 5 series. Now, the next human pathogen to discuss is called Legionella pneumophila, that leads to one out of two different diseases, either Legionnaire's disease or Pontiac fever. Okay, so these two diseases are different. Okay, they are not synonymous with each other. So let's talk first about where do we find Legionella pneumophila. It's usually found in water. Okay, and the source of the infection in Legionnaire's disease in particular is the HVAC system or the supermarket vegetable sprayers. You know, when you go to a supermarket and these sprayers that to keep vegetables and fruit kind of moist. Well, yeah, that is a source of infection. Another source are volcano fallouts, but at least for us, where we don't have volcanoes around, we should be focusing on the HVAC systems and the supermarket vegetable sprayers. The treatment are antibiotics. Okay, again, you don't really have to know which antibiotics in particular, but I do want to talk a little bit about Legionnaire's disease and Pontiac fever, the differences between them, and how they were first diagnosed. So Legionnaire's disease, that is the severe form where the patients have pneumonia. And the first outbreak of Legionnaires was in 1976 in Philadelphia that affected the American Legion members, hence the name Legionnaire's disease. And about 29 of them died due to that severe pneumonia. Pontiac fever is a milder infection where the individuals have mostly, again, flu-like symptoms, okay, and they do not have the pneumonia. So the main difference between Legionnaire's and Pontiac fever, that in Legionnaire's pneumonia is present, Pontiac fever pneumonia is absent. So where did the name Pontiac fever come from? Well, ironically, it came because there were flu-like symptoms that were spread among those who worked in the health department, actually in Pontiac, Michigan. And I believe this was somewhere in the late 60s, so maybe 68 or 69. And it was discovered, or Legionella pneumophila was isolated from these individuals. And because they didn't develop pneumonia, they got a different name, and it was called Pontiac fever. Excuse me. And then years later, when the American Legion members, they got the Legionella pneumophila infection with the development of pneumonia, so it was considered a separate disease. Again, it's more prevalent when due to the exposure to an HVAC system, and that's how the Legion members contracted Legionnaires the first time it was diagnosed. Again, it's found in the supermarket vegetable sprayers and volcano fallouts. Okay, and this ends this part. In the next part, we'll be talking about enteric diseases.